Hi, I'm Jerrod, Ullah, CEO and founder of HealthTalk A.I. Well, we built a virtual care platform that allows providers to engage their patients wherever they are in any language, identify gaps in care, and we close the loop with virtual encounters. Well, you know, as a nurse, in my background, we were trying to solve the problem. We're giving apps to patients, we're giving, portals to patients, but there's just too many barriers associated to it, right? The patient has to find the app, the patient has to download it, the patient has to create a username and password. So what was really happening in the market was folks were really not connecting. They were coming up with a digital strategy or a clinical strategy after to reach the patient, but then the last 100 feet were kind of falling down. So HealthTalk A.I was kind of founded really to solve the problem of connecting providers to patients when it really mattered. Yeah, a case study and that in action is really was one around COVID, right? You have a health center that has 30,000 patients. How do they actually treat those patients, reach those patients when they can't see anybody in person, right? What our platform does is help them engage them at scale using a bot technology to understand whether those patients are having COVID symptoms and then scheduling them with telehealth or an e-visit so they can get the services, health service they needed. How did COVID impact HealthTalk A.I? It was an accelerator for us. Really, what folks realized that maybe had not implemented a virtual strategy, that they needed one. And so our success of being able to actually implement and attack problems like virtual care in COVID, being able to get live very quickly kind of spread in terms of the folks understanding that the need was there. Yeah, I think we're really testing the kind of robotic automation of communication. And that's really, we're kind of at the ground level of that right now. I think the future in 25 years, this would look a lot different. We use voice assistants now, but not into the detail around our care, right? So in the future, we could be using voice assistants, we could be using smart TVs, or we could even be using our automobiles to interact with care in a way we haven't even thought about, right? Yeah, no, we're really excited about, we're a growing team. I think we're really people are starting to understand the problem that we're solving. I think, people understand that virtual care is not something that they can have or should have, it's a have to have at this point, right? And so we're kind of meeting this time, I think, in terms of telehealth and virtual care where I think there's gonna be really explosive growth over the next several years, and we're excited to I think personally I'm excited to be, out with customers face to face and actually kind of working alongside them. That's what I'm excited about.